Good morning, everyone. Today I'm excited to share with you insights from our recent publication in the JMIR Dermatology Journal, which is a leading journal that explores the intersection of dermatology, medical innovation, and digital world. Our study represents an example of how modern dermatology continues to evolve in this connected, digital, and AI-empowered world in every aspect, including the aspect of dermatology education. So, can artificial intelligence teach dermatology? Or more precisely, how realistic can AI-generated clinical scenarios really be? Or do they represent a too perfect version of clinical reality? It is indeed fascinating to use generative AI tools such as ChatGPT in order to create content in dermatology. However, questions regarding ethics, authenticity, and accuracy of this content arise. And if AI invents a case, how can we appreciate if they reflect true skin condition and true skin lesions or a digital fantasy? So indeed, chatbots are not only in the hands of medical students, dermatology residents and dermatology trainees, but also in the hands of tutors and dermatology educators. So indeed, we can use chatbots in order to process multiple dermoscopic or macroscopic images, and we can identify patterns and make clinical diagnosis. We can use it for statistical analysis or for search purposes, also in order to simplify or clarify a complex concept in dermatology. And also we have seen medical students using them in a creative way, such as in order to create mnemonics or acronyms in order to retain complex knowledge such as RASes, treatments, or syndromes. So generally, with chatbots, we have direct access to differential diagnostic lists, protocols, and guidelines. But we need to bear in mind that those recommendations can be unverified, outdated, or incomplete. So for every bullet of this slide, there is the other side of the coin. So, for example, in case of medical diagnosis, if the dataset provided is biased or incomplete, then there would be a chatbot-aided misdiagnosis. Let's see some examples. Herein we can see the simplification or clarification of a complex concept in dermatology, such as the pathophysiology of hidradenitis suppurativa. And we can see that the chatbot breaks this concept into a step-by-step understandable content and also creates a figure showing the pathophysiology at a glance. Here we can see that the chatbot proposes a mnemonic and an acronym for the adverse effect of isotretinoin, which is a high topic in dermatology, and proposes the same word, isotretinoin, so the medical student doesn't have to memorize a separable mnemonic, and each letter represents a separate adverse effect. Also, we can see that it can create exercises with different difficulty level and with different focus. For example, herein we can see that create USMLE step 1 versus USMLE step 2 question, and the USMLE step 1 can usually test for pathophysiology, biochemistry, pharmacology, and molecular mediators in case of rosacea in this case, while on the second exercise, on the USMLE step 2 exercise, it tests the clinical skills, the recognition of diseases, the choice of the best diagnostic tool, as well as the best treatment approach, here being topical metronidazole as the first-line treatment for rosacea, and avoidance of topical corticosteroids that can worsen the disease. So in our case, and based on this concept, we assessed large language models such as ChatGPT, whether they can create engaging, motivational, and clinical relevant scenarios for medical students. Each AI exercise was matched to a non-AI exercise on the same topic and with similar educational objectives, and a questionnaire featuring a mixture of AI and non-AI questions, including case-based multiple choice question, which is the most popular type of question in medicine, as well as true and false question statements and correlation exercises. So the medical student assessed each question on a Likert scale of 1 to 5, assessing how educational, motivational, or challenging each exercise was without knowing its creator. Let's see some examples. We can see here two cases presenting patients with plaque psoriasis. In the first case, which is AI case, we can see a detailed description of medical reports and also the report of triggering factors such as stress or cold weather, detailed physical examination findings as the type of scale and nail psoriasis. Also, family history is also included. Question 2 asks for a treatment approach, and question 3 for assessment of psoriatic arthritis. Now, in case of the non-AI exercise and report, we see a more personal perspective. We see a patient who sought help, who was concerned about her cutaneous symptoms, and who had received treatment from another specialist for a manifestation that is connected to the disease. Also, question 1, we see a differential diagnosis of papulosquamous disorders such as parapsoriasis, and also that the parapsoriasis and psoriasis can confuse the student because they have similar vocabulary. And also we can see that question 1 tests students in order to differentiate diseases that have both cutaneous and musculoskeletal disorders such as dermatomyositis and psoriasis with psoriatic arthritis. Question 2, we can see question D has A and B, meaning that it has a combined answer that's characteristic that we do not see in AI questions. And question 3 asks about the systemic implication of the disease. The next pair is about non-melanoma skin cancer, both being BCC. Both cases have a detailed description of the lesion, being the visible small blood vessels, the delectations, and the prognosis. Both questions 1 ask about differential diagnosis. Question 2 in the AI case ask about the key risk factor, being chronic sun exposure, and question 3 about the treatment. In case of the non-AI, I want to point out that the occupation of the patient is reported being farmer, implying or reporting indirectly the chronic sun exposure. Okay, let's move on. Another pair of cases. Also, I want to point out that question 3, again, ask about the topical treatment of rosacea being metronidazole, which is also reported in our previous example of USMLE step 2, meaning that there is a repeatability of question creation in AI case. Also here we can see another type of exercise being true or false questions. The focus in both sentences about the duration of skin diseases. The AI created sentences focus more on the prognosis and treatment approach, while the non-AI case tests more the duration that is associated with the nature of the disease. For example, acute urticaria is present for less than 6 weeks, and that duration differentiates from the chronic urticaria. Here we can see a correlation exercises with psoriasis subtypes and clinical manifestation and special site involvements. And as a result, the non-AI cases had similar or higher scores in challenging educational and motivational categories or dimensions. The challenging category was somehow expected. The educational and motivational was attributed mostly to the empathy nature of the questions. And also worth mentioning is that the case of the true or false statements and the correlation question, there was no statistical significance. And that means how important is the storytelling and the narration that favors the non-AI cases and exercises. Generally, also we have noticed some characteristics that can differentiate AI-generated case from non-AI, such as the detailed case description and the detailed analysis of medical history and clinical examination findings, while on the other case, the non-AI exercises are shorter with more focused clinical dilemmas and direct and challenging questions. So AI exercises and content is important and can help or test our understanding. And we should not neglect them, but always that the clinical scenarios can be of real world can be superior. And in this point, I would like to thank you all for your attention, and of course thank my team for the excellent work and contribution, as well as the JMIR publication for considering and publishing our work.